Hi. Hello, everyone. Hello, hello. How are you? I'm going to take off this on my computer. Hope everyone's okay. How are you? Let me see if everyone's here. Hello, hello. Welcome to Q&A with Dr. Mercy. I am Dr. Mercy. Hi, everyone. Happy Friday. Hope everyone's doing well. Hope everything is going well with you. Hi. Let me see here. So before we begin, let me get over here. Just one moment. All right. So hey everyone, hi, happy Friday, happy Friday. Hope you're doing well. Hope things are going great with you. I'm Dr. Mercy, and you are hearing a Q&A with Dr. Mercy. First of all, like I always like to do, I always want to know where everyone is viewing me from. Hi, Miss Faye, how are you? Okay, from St. Louis. Awesome. Good evening. Good evening. Good evening, Alex. How are you? Hi, Marva. Hello. Hello, Gwendolyn. Hi. Nice to see you again. And Daria, how are you? Okay. Shireen, you're from Chicago? Oh, that's awesome. Oh, you're watching from Southern California? Good. Hi, Nigel. How are you? Uh, do I believe in cannabis medicine? That's a good question. Um, I do to a certain extent, okay? From the for the pain management qualities of cannabis, I do agree that it is a good use for that. Also, I've seen it benefit those who have epilepsy or seizures. But even though there are some positive attributes, what people don't know is there can be some negative attributes in cannabis. And in particular, I've admitted several people who have this condition where they're always vomiting and having chronic abdominal pain after years of cannabis use. And they're very characteristic of maybe going through withdrawals. You see them at night, they're always itching, and they require always hot showers. And a lot of times for those people, it's really what we call supportive care. It is controlling their nausea and controlling their abdominal pain. So, cannabis and too much of it for a long period of time can cause problems. That's something that they don't tell you. So, though I agree that cannabis is can be beneficial for certain conditions, I think like the adage always says, too much of everything is bad. Even water, too much of water is bad as well. So, yeah, I just wanted to say that. But thank you for that question. If you guys have any other questions, medical questions that you think I can be able to help you answer, yes, feel free to jot them down during our conversation. But also note that I'm not your personal doctor, so I can't go into like your personal care. But if you want to just talk about general questions, feel free. Okay, Nigel, you're watching from Washington, D.C., Cincinnati, Glenn, great. Nashville, awesome. And hi, Shirley. Hello. Well, thank you guys for watching. Thank you guys for commenting. We are here with another episode of Q&A with Dr. Mercy. Just this time around, what I want to do is I want to continue from our last conversation where we were talking about things doctors wish you knew about um, when it comes to hospital stays. And I know, just kind of recapping what we talked about last week, there were things, for example, knowing your code status. We explained, do be aware that that's a question that will be asked, whether or not you would want to be resuscitated while you are in the hospital. Even if you're coming in the hospital because you stubbed your toes or you need surgery, they're going to ask you that question. So be prepared to answer. If something life-threatening, such as your heart stopped or you stopped breathing while you're in the hospital, what will your wishes be? Be prepared for something like that. Also, be prepared to have your medication list available for you. I'm sorry, it seems like the light is getting, my light is a little bit, okay. Hopefully this is better. Be prepared for having your medication list. The medication list that we always have on file is not always going to be the accurate one. So be prepared to provide that. We also talked about um, not being afraid to ask questions. We also talked about things that happen behind the scenes, that there are a lot of things that happen behind the scenes that you may not be aware of. And so if your doctor comes in and comes out of your room, just know that that is not an indication of whether or not they're working on your case. They are working on your case. It's just a lot of things happens behind the scenes. So I just wanted to kind of come back and kind of finish that topic. If you guys have any questions, make sure to jot them down in the comments. Like I said, it could be related to this topic or other topics. And also, speaking of topics, if you have any pressing topics that you want us to kind of just talk about, or you want sessions where we just freestyle and you guys ask questions and I try to answer them to the best of my ability, please make sure to jot that as well in the comment section as well. I want this to be an engaging 30 minutes that we spend every Friday. So, okay, so continuing on, the next thing is that also, I always get, and I don't understand, is a lot of people, they come in, they're short of breath, or they may have chest pain. And so they tell you, their symptoms, and you explain to them, okay, we're going to do this, we're going to do that, we're going to get this doctor on board, we're going to get that doctor on board. And, hopefully with all of this, you'll get better. The next thing they want to ask is, can I go home? And I'm like, no, you can't go home yet. So I say that to say that rather than asking, can I go home? Ask, doctor, based on what you just told me now, how long do you think I will be staying in the hospital? That will help the doctor help you understand, okay, the process. Just in case everything that was already discussed didn't give you an accurate idea of how long you're going to stay in the hospital, rephrase that, can I go home, to how long will I be in the hospital? Keep in mind, it's a good idea to make your intentions clear, especially if you have other things going on, such as, oh, I have a wedding this coming weekend, or I have to go to work. If I don't go to work, they'll fire me. Make sure you let your doctors know, because a lot of times we don't know what's going on with your life. So if you have something pressing that's unavoidable, say that to the doctor so that they can now adjust their plans if they need to, and some of the stuff that they plan on doing with you during your hospital care, they can maybe have that done in the clinic when you leave the hospital. So definitely it's a good idea to always say, especially if you have any pressing issues or events, it's definitely a good idea to let the doctors know who are admitting you to the hospital. But saying, can I go home right after you're coming in with shortness of breath and you're placed on oxygen? Yeah, probably wouldn't be a good idea to do that. But rephrasing it and saying, hey, how long do you feel I'll be in the hospital, would be a better way to say that same thing. I think I told you last time, make sure to ask all the questions that you have. We try our best to explain what is going on with you and what, imaging and what labs are necessary for your care. But sometimes, we're also in our technical mind, and we've been doing this for many years, a lot of us. And so we may say it in a technical term that you may not understand. So always feel free when you're in the hospital, ask away. Like the old adage says, no question is a stupid question. In fact, we love when patients ask about their care, because it means that they're really paying attention and they're serious about it. And so we take that to heart when you're asking. Again, no question is a stupid question. Just ask. If you don't know, just ask. You're paying us to help you. So make sure that you use that money wisely and use it effectively. If you don't know what's going on, or you're not quite sure if you want to do what we're saying, make it vocal to us so we can tell you, okay, that's okay. If you don't want to go that route, we do have this other route. And if you feel more comfortable with this other medicine or with this other procedure, we'll go ahead and do it that way. We're here to help you, okay? So make sure you ask questions. Another thing that as a hospital doctor, I wish sometimes the patients who go into the hospital would know is that you can always make sure to always not only ask questions, but make sure to ask for your labs and imaging. If you want to know what's going on, and you just ask. A lot of times, and I think we said this before, but if we didn't, a lot of times in the hospital rooms, there's always a computer there. And so while we're typing, we're looking at your labs and your imaging and trying to explain it to you. If you want to see the report directly, just ask away. If the doctor's not there and you want to know what that CT image that they took was, you can always ask the nurse to provide you with a copy. So make sure that whatever you need to feel comfortable with your care, make sure you ask for it, because we can provide it, okay? And speaking of asking, at the end of every hospital stay, there is a period where you're going to be discharged. And when you're discharged from the hospital, make sure you review the paper and the forms that the nurses give you. A lot of times that includes your prescriptions. So make sure you review the prescriptions, okay? And a lot of patients, for whatever reason, they may run out of their medications that they typically take at home. At that time, or even prior to discharge, make sure you let the doctors know, hey, I'm running out of so-and-so medication. Before I leave the hospital, can you please prescribe that for me? And then when you get discharged, make sure you review in the form, and that it includes that medication that you need a prescription for, that it includes that there is a prescription waiting for you in the pharmacy. So always look at your discharge paperwork before you leave the hospital. It will save you a lot of time and effort instead of having to come back or calling that you didn't have so-and-so prescription, or you don't really understand what's going on. Make sure you are aware. And if that also includes excuses, we do provide like a job excuse for you. So if you are in the hospital and you've been there for even 1 day, 2 or more days, and you're getting discharged, ask for a job excuse letter from the hospital, and we can be able to provide that for you for your workplace. So that's another thing that we can make available for you. I already explained the purpose of the night docs, but I want to reiterate it during this video, because I don't know if everybody had seen the previous video. If you haven't, please do. But I'm a nocturnist, and so I work at nights. And a lot of times I've seen recently, or actually I've seen for years now, that people may be confused of what a nocturnist or night doctor does. They assume that just because I am a doctor within the hospital, that I'm also involved in their care. And they may have seen me once and they think that I'm also part of the team. Well, they're partially right and they're partially wrong. If you come to the hospital at night, a lot of times, especially in this particular hospital I work at, a lot of times you'll see me. And I will be the one that will admit you to the hospital and explain what the initial plan is. But keep in mind, the only reason why you're seeing me is because the day doctor has left for the day. And so I'm the covering doctor for your care for that night. A lot of times I like to tell the patients that although you're seeing me tonight, after tonight, your care will be transferred to the day doctor. And moving forward, it will be them who will be continuing your plan, maybe changing some of the stuff that I do. And they'll be the ones that ultimately discharge you. Now, where the confusion comes about is they think that because they're being admitted at night, that the doctor at night is their primary doctor. And I want to emphasize this. The answer is no. The primary doctor is the doctor that sees you during the day. So they're the ones who now come before they come into your room, they get report from us, the night doctors, as to why you're here. They get report from us as to what we've done so far for your care. They may decide that they want to continue the plans that we've already started, or they may adjust it based on new findings, your condition, and things of that nature. So once your care has been transferred to them, they now have full control. So if I come back the next night and you're still there, you may want to ask me, hey, what's the plan? More times than not, I would not know. And why? Because I'm no longer taking care of you. It is the day doctor. So a lot of times, especially if you go into the hospital at night, if you need any questions of your care, you want to ask the day doctors during the day, hey, what is the plan for my care? I know I was admitted last night for pneumonia. I'm feeling still not too good. I heard that I had some antibiotics. I'm getting some pain medications, some cough medications, but I'm still not feeling well. I want to know, what is my plan? That is, the day doctors are the ones who you should ask that to. Now, the night doctors, when I said you're partially right, is we are a little bit still a part of your team. How we work is, if you need something like cough medication, pain medication, sleep medication at night, the nurses will tell us that, hey, so-and-so needs these medications, and we will go ahead and order them for you. Our job is to make sure that you're comfortable at night. Our job is also to make sure you're stable at night. So if you become unstable, if your heart stops, or your heart starts acting up, your lungs start acting up, we're the ones who will now come in and try to stabilize you. But that's all we do for you while you're in the hospital at night. We're not the ones that make the decision of your main care unless it has to do with you being unstable at night. I hope I'm making a little bit of sense. So I just wanted to bring that perspective and also repeat it, because the hospital medicine has changed recently over the years. I still was a part of that time when it used to be that your primary doctor would come to the hospital and also take care of you when you were in the hospital. I still remember those days, and that was in the beginning of my career. But it's now transitioned to where it's no longer the clinic doctors coming into the hospital. We've since now divided the care, primary care, to clinic doctors staying in the clinic and hospital doctors staying in the hospital. And it's now that we're even further dividing it within the hospital system, where you have the day doctors, who are the main doctors that take care of the patients, and the night doctors, who are just covering for the day doctors. So, there's certain dynamics that are happening in hospital care and in medicine in general. So I felt like the more you know, the better it is for you to navigate that system. So that's that. And then I think the last thing that I wanted to talk about is, what are some of the etiquettes when you are, initially being seen by the doctor? I know a lot of times when you're seen in the hospital, you have your family members who are so, wanting to help. And I love it when family members come in and are also able to help explain what's going on. That just gives a full picture, and it allows us to get an understanding of exactly how severe the condition is, what type of condition this is, because sometimes the family members bring a sense of additional knowledge that the patient, either maybe they're too sick to say, or they may be confused. So, I love it when they come. One of the things that, would be a good idea, when you are a family member and you're visiting and the doctor is there, as you are giving your information, also observe your surroundings and your environment. It's a great idea to give the information. It's a great idea to be to give knowledge to the doctor. But if the doctor's within a computer and is typing along, it may not be to the best. It may not be a good idea to just be directly behind them as they're trying to type and just kind of hovering over them, because sometimes when the doctor's trying to type and speak to the patient and try to speak to you and you're right behind them, it brings them in a very uncomfortable situation. I've been in that before, and that's why I'm saying it now. If you need to, or you want to see what the labs and images are and the computer, feel free to come up and view it. But also make sure that you, as you are speaking, make sure that you give the doctor maybe a healthy distance as you explain what's going on, so that everyone in the room can see each other and there is not this awkwardness, if I say so. Again, great that you're coming, great that you're with your family members, but be cognizant of the environment, and ask who the doctor is, ask their credentials, feel free to do so. So yeah, I just wanted to kind of end that etiquette conversation with that. I really enjoy hospital medicine. My best part of it is speaking with the patients, being able to explain not only their condition, but also preventative measures. And even though I speak to my patients sometimes at 2, 3 in the morning, the thrill of being able to see when they finally understand what's going on with them all these years, I love that. I love that. I love it. I love those who are really appreciative of me being able to explain things to them and they getting it. And so you, as a physician, when you initially go into a patient's room, you feel their sense of anxiety. You feel their sense of fear, because a lot of times they don't know. And so being able to navigate that for them, and then they have that aha moment and you see it in their face, oh, that is just awesome, because now they're in tune with what you know. And then you can tell, because when they're asking questions, these are questions that someone who understands would ask. So it's like we see each other type situation, and it's always great to have that happen. So I encourage you to, if you take these steps that I have stated in this video and in the previous video, I think your care in the hospital will be a good one. So, I want to know my blood type. Well, yeah, okay. In order for you to know your blood type, and it's really important, you'd have to get your blood type from the lab. Either your primary care doctor can give it to you, or an unconventional way of you knowing your blood type is by you going to the blood bank and giving blood. Part of the test that they do for prior to part of the test that they do while they're getting your blood is they screen it, and they screen it for all types of diseases, bloodborne diseases such as HIV, even I believe COVID. No, definitely COVID. And they also do your blood type. So, I would just say go to your primary care provider and ask them for your blood type, and they should be able to give you a lab slip to go and get it done. Hey, Thelma from Houston. Hey, neighbor. Okay. I'm just looking at this, at our questions here. Faye Marshall says, hello, you mentioned too much water, not good. How much should we drink? I'm on a 4 to 5 bottles a day. Is that good? So Faye, thank you for this question. Yes, too much water is not good. And the reason for it is if you get too much water in your system, it can affect one of your most vital organs, which is your brain. If you get too much water in your system, it can expand your brain and you will have confusion and could cause things, damage to your brain. So you don't want that. And it can also do other things, such as affecting your electrolytes in your system. So how much water should we drink a day? I did do a video on this, but essentially, women should have about 2 liters and men should have about 3 liters, but really everyone's different. So, but those are the average that people should have. And you drink about 4 to 5 bottles a day. I'm thinking that you're drinking bottles such as the one that I have here. So if you have 4, this is about a 500 ml bottle. So if you're drinking about 4 to 5 of those, I believe you're drinking about the recommended amount that you should be drinking. Again, how you can tell that you are drinking an adequate amount of water is based on your body signs. For example, if you go to the bathroom and you're noticing a very dark amber urine, you're not drinking enough water. If you are noticing that your urine is just way too clear, it's almost the color of the water, of the toilet water, then it may be a little bit too much, or it may be ideal. You just have to look at different signs. Also, your tongue is also a great sign of how much water you're drinking. If you stick out your tongue and you're noticing it's dry, you're not drinking enough. But if there's some glistening to it, okay, it's adequate. Majority of the times, your body does tell you whether or not you're dehydrated or not. So the thirst mechanism is important. If you're thirsty or even hungry, okay, hunger can also be a form of actual thirst. So if you're hungry, you may want to first drink some water and see if it's really just thirsty. So yeah, I hope that answers your question. Thank you. Okay, Rachel Shelley Lee says, my mom has been diagnosed over 11 years with Alzheimer's, and CBD has her doing great. Thank you for responding to my question. Great. And like I said, for epilepsy and your mother, Alzheimer's, that is still a condition of the brain. It has helped those who have used it. Again, everything in moderation. And I'm pretty sure your mother is probably has a doctor that's helping her with that. So yeah, I mean, it's definitely an option for those who need it. All right. And I think that is it for today. Thank you guys so much for coming. Let me see here. What type of doctor? Robbins, I don't understand what this question is. What type of doctor? I think if you're talking about what I've been saying, it's what type of doctor is a nocturnist? I hope that's your question. If that is your question, it is. A nocturnist is a night doctor. We primarily work at night, and we primarily work in the hospital. I hope I answered your question. If not, that's fine. Renee Rice, hi from Fort Worth. Hello from Texas. All right. Okay, this is a good one too. How weird is it that a guy gets a UTI? It's not really that weird. It's very common, especially as we get older. Okay, I had to admit several men for UTIs, and the reason why is the mechanism of the bladder that leads to the penis. There's as we get older, sometimes the flow does not completely flow forward and can go backward for a number of reasons, and that can cause a UTI. Also, if we are not properly emptying out our urine in the bladder, that urine can, and although initially it's sterile, it can become infected, and that can be an issue. I see a lot of guys that also have underlying prostate problems also get UTIs. And so it's actually common when people get older. But if you're constantly having urinary tract infections on a constant basis, I do suggest that you see a urologist. And a urologist will be the one that can easily help you, easily help to conduct studies to see how well the flow is. And if there's an obstruction, they can now find out where exactly or what exactly is causing the obstruction. So I would, if you find that you're having them frequently, I would definitely check with a urologist. All right, everyone. Thank you so much for coming. And I think this will be the last question. And I will see you next week. Until next week, have a wonderful, wonderful weekend, actually. All right. Bye.